I come to you from Chicago. This last couple of days, we've been back up here talking to the schools of pharmacy, talking to the student pharmacists about advocacy and the importance of helping be a voice for your profession. But it is definitely good to be back engaging with our members again out on the road. And you'll see later this summer that we'll be doing some regional meetings, and we hope that you can take time to come and listen to about what's going on in this state that's really good for the advancement of pharmacy, and where we need your assistance in helping advance further reforms, particularly with pharmacy benefit managers and in workplace reforms. And we've talked about the workplace the last couple of months, and that is a topic we will continue to be focusing upon because it's not going away anytime soon. And we definitely need to keep working hard to help improve how we deliver care. And that starts not only with the workplace, but it also keeps continuing to work with how we address the practices of pharmacy benefit managers. In the last couple of days, CMS federally has announced a DIR rule, which is supposed to be a fix for DIR. I'm trying to remain an optimist about it, but I do fear that we will find, unfortunately, new methods from the PBMs in ways that they will destroy and continue to hurt pharmacy and hurt our patients. And I hope I'm wrong, but we need to continue to educate our congressmen and our senators as we work to advocate for real change in Medicare Part D. And that is one thing I implore upon each and every one of you, especially as we look at 2022. We're in election year. We are within 2 months of the state's primary at the end of June, and of course the general election in November. Healthcare is going to continue to be a primary topic, and we need to be reaching out to our state senators, our state representatives, our U.S. senators, and our U.S. representatives, and getting them into our stores, getting them in behind the practice, whether you're an independent community pharmacy, your long-term care, your chain pharmacy, or your health system. We have to start advocating for ourselves in a much clearer way. Healthcare is always a complicated issue, and pharmacy doubly so. Insurance continues to manipulate and move in ways that continue to try to pin the evils of what they're doing upon the practitioners. And our patients continue to suffer. And we can't allow that to happen anymore. We have to stand up for our profession. We've worked extremely hard over these last 2 years in the middle of a pandemic to ensure that our patients had their medications they needed. Our profession saved this country. And we're starting to see, quite frankly, we're starting to see the old practices come back of devaluing the profession. And enough's enough. We have to start treating pharmacist-delivered care as a right for patients. And pharmacist choice is a definite foundation of that. And we can't continue to allow governments and insurance plans to continue to manipulate and get in our way of our patients' right to their pharmacist and access to their medications. So I implore you to join us. Help become part of the solution and be the voice for pharmacy in Illinois. I know we've asked a lot of you who have been longtime members of the association, and I want to thank you for all of your help over these last number of years. We have done some magnificent work recently. And one of the things I shared with the students today was taking through a journey of House Bill 135 and what we were able to do with establishment of pharmacist provider status and recognition of our patient care services, at least in the realm of women's health. And it's a beginning. And we've added on to that in this session with HIV PrEP and PEP for coming forward in 2023. This is just the beginning. We're in a paradigm shift for the profession. Unfortunately, we're in a double-sided paradigm shift, both positive and negative. We are at the precipice of change, and how pharmacy is going to look and how patient care is going to change will depend on you and how much you're going to be willing to step forward and have your voice heard. IPHA is here to help lead that fight, and we need your help. So please go to IPHA.org, renew that membership, and help appear. Learn how much we are helping move the profession forward and that we need their help too. If you have any questions, please reach out to us. We are here to assist you. Have a great day.